Welcome to Blub Talks. I'm Robert McKenzie, teaching sensei at Speech Blubs. And today we'd like to introduce Kjirsten Broughton, a licensed SLP in the state of Nevada, and she holds a certificate of clinical competence through the American Speech and Hearing Association. Kjirsten is also a certified Hanen provider and trained in PROMPT, the Lee Silverman voice treatment, and PECS, the Picture Exchange Communication System that allows people with little or no communication ability to communicate using pictures. Now, Kjirsten frequently sees kids to help with autism, delayed speech, language and speech problems, and speech disorders and impediments. If you're interested in contacting Kjirsten, she also provides online teletherapy sessions. Hi, Kjirsten. Good morning.
Hi, Robert. Good morning. Thanks for having me.
Thanks for being here. I appreciate it. Let's start with some questions and clear up some confusion. This confusion is in our social media community about identifying the early signs when a child qualifies for speech therapy and whether or not to try the wait and see approach for late talkers, late bloomers, etc. Could you clear this up for us, for our parents?
Absolutely. So, I mean, of course, there will be some children who have and will grow out of a speech delay, but there's really no way to know if that's going to happen. And so with the wait and see approach, a lot of times those families will end up coming to speech at a later time.
Right.
And, you know, of course we can make some progress at that time, but research really shows that early intervention, so getting into therapy as early as possible, gives us the best results. So I always recommend you just book the evaluation. If when it comes time for that evaluation, you don't need it anymore, awesome, cancel, but, get in for the evaluation and see the professional as soon as you can.
Right. It seems like the choice of rolling the dice or not, and it seems much smarter to do the evaluation right away.
I think so.
Mm-hmm. So our parents are also concerned about identifying developmental red flags. Mm-hmm. They're not experts like you in seeing something that could be an issue. Could you offer some advice about milestones and which red flags might present themselves?
Sure, absolutely. Well, for parents, I would really just say trust your gut. You are the professional on your child. If you are feeling like your child is not kind of at the same level developmentally as peers, whether that's with how much they understand, responding to their name, speaking. And so that's, using language and vocabulary at all, or maybe your kiddo is talking away, but it's just more difficult to understand them than peers. All of those are signs, mention them to your pediatrician. Unfortunately, some pediatricians will kind of advocate for the wait and see approach. Call a speech pathologist, kind of let them know what you're seeing, book that evaluation, because pediatricians, they're generalists, they know a little bit about lots of things, but a speech pathologist is really going to tell you what is appropriate for your child's age.
Yeah. Now, I know you have close contact with children on the spectrum. And could you describe for our audience the difference between autism and late talkers? Is it just apples and oranges, or?
So what's that? Sorry?
Can they be both, have autism and be a late talker?
Yes, absolutely. Late talking is one of the signs of autism, and not always. Sometimes kids with autism can have, a huge vocabulary, but there are some other signs, some repetitive behaviors, possibly some, like a major interest, something that they're really interested in. And so for children that are verbal, they might just be talking about their favorite thing a lot, all the time. For kids that aren't talking, maybe it's just a certain item, and it could be a toy or a non-toy item. Like it could be a little car or like a spatula that they just want all the time. If they don't have it, they might get really upset. Maybe not responding to their name, poor eye contact. But lots of the times when you see these red flag lists, I think, oh, my kiddo has great eye contact. There are kids on the spectrum that have great eye contact, or even too much eye contact sometimes, kind of some difficulty with social skills. But when you read those lists, every child is different. Kids with autism do not present the same way. And so unfortunately, sometimes when parents talk to the pediatrician, they might just have a few little red flags that they go through. And if the kids aren't matching up with those, it's like, oh, your kiddo's fine. Let's wait and see. But really getting into a professional who can kind of take a little bit longer than, a quick 5-minute visit with your pediatrician, watch how the kiddo plays, talk with the parents more about what the parents are seeing at home. And, is the kiddo playing with peers? Things like that. So really, if a parent has any sort of concerns about speech delay or about autism, go in and see someone and continue to advocate for your child. It's really important.
It seems like this evaluation is the cornerstone moment, the nexus for all the good things that will happen after that. So I get it. Okay.
Yeah, it is important. And I guess one more thing on that, just like getting a second opinion, if your doctor says to wait and see, you can get a second opinion from another speech pathologist. If a speech pathologist says your child's not ready for speech, right, or I don't know, and you still feel like, this is just not, my child's not, on par with their peers, go and see someone else. You can ask the speech pathologist, what is your specialty? Who do you work with? And then you can even ask them what kind of trainings they have in that area. Because we're not all created equally, so make sure you ask those questions.
Any doctor or practitioner, you don't always have a connection that allows them to see everything that you see in your child. So perhaps it's just seeing a second person that may be able to bring some of these issues out in a different way.
Absolutely. Absolutely.
Meet Elliot. He's a 3.5-year-old diagnosed with autism 6 months ago. Before his diagnosis, he could only say 15 words. He started using Speech Blubs, a speech development app, almost every day. Fast forward, and now Elliot can speak well over 100 words and even uses 2 to 3 words together. His parents are thrilled, especially since speech therapy sessions are so few and far between. What an amazing success story. Way to go, Elliot. Now it's your turn. Download Speech Blubs for free and start expanding your child's vocabulary from the comfort of your own home.
Okay, next question. If parents and children show a need for speech therapy, the parent thinks there may be something not quite going right. What are the next steps? You said, okay, get an evaluation, but before the evaluation, you probably get referred by a pediatrician to an evaluation?
Yes. So the first step is going to be mentioning what you're seeing to your pediatrician. You typically will need a referral, not always. Like my company doesn't accept insurance, so you can just give us a call and we'll schedule with you. But if you want to go with insurance, you can call the number on the back of your insurance card and say, hey, who are your providers in my area? And they will tell you who they are. You can call that company. That company may ask for a referral from your doctor, but first step's talking to your pediatrician. And then going from there, you can even reach out to the speech therapy offices.
Oh, nice. And then after you give the evaluation, then what happens?
So during the evaluation, that is the time that we develop goals. And so that's, based on, we usually do a combination of like a formal assessment and some informal things. So like play, observing the child, lots of information from the caregiver. We're going to develop goals based on what we see, as well as, things that are important to the caregiver. We determine the frequency and duration of therapy based on our findings in the evaluation and go from there, start therapy.
Super. And now, how do pediatric speech therapists work? Is it all through play? Is it through using outside sources like Speech Blubs? Do you have go-to exercises that you've used for a long time? How does it work exactly? Because as a parent, I know I would be nervous going in. I know what's going to happen. What are we going to do? Will my child succeed or will he fail? Is there succeeding? Is there failing?
No failing, no need to be nervous. I mean, I understand you're going to somewhere new, and the kiddo can a lot of times be uncomfortable if it is a new environment, someone they've never met before, they don't know what to expect, they don't know how long they're going to be there, all understandable. But as far as, strategies and therapy approaches, it really depends on what we are looking at with the child. So when we do an evaluation, we look at a couple things. We look at language. And so within that, we look at receptive language, how the child understands language, and their expressive language, how they use language, vocabulary, word combinations, grammar. Let's see, we look at social skills. We also look at articulation, so speech sounds. So it really just depends kind of what areas we're looking at. It might just be one area, it might be a combination, and go from there.
And where do you land as far as using play as a way to learn?
Play is huge. I do lots of play-based therapy, especially with language. We learn the most when we're engaged, and kids are engaged in play. As long as the kiddo is having fun, you can use language in so many different ways, modeling language, just really talking about what we're playing with. And even if the kiddo is not saying anything back, or even, maybe just looking at the object and not looking at you, they are listening to those words and they are learning that way.
And I would imagine if the speech therapy is fun, the child is more likely to look forward to it, to do the work between sessions, to actually engage with you when he or she shows up.
Absolutely. Yeah. You want to make it a fun, you want to develop that rapport with the kiddo and, use what they are interested in, whatever kinds of toys, or even, non-toy things that they might like. Some kids with autism don't really like typical toys or typical play. So they might, like something a little bit different. And I'm just going to jump in and do that with them and do that to start.
Yeah, my kids, I don't know what it was, but they both like pots and pans. I would just open up the drawer and they'd start pulling out pots. And it was loud, it was messy, but it didn't matter. They would be engaged for an hour. You just go, oh my God, now I can do cooking, or I can do business, whatever.
Absolutely. Yeah. You really don't need to, buy anything fancy. You can play with a box, pots and pans. Yeah. Kids will have a good time as long as you're animated and making it fun.
Excellent. Now, I wonder how your practice has changed during this pandemic. I would imagine you're doing more online therapy in the last, 15, 16 months.
Yes. So I had never actually done teletherapy before the pandemic, but lots of clients reached out and wanted to go that route, and it's worked really well. Clients of all ages.
You're not bound by location either as well.
So with teletherapy, you do need to be licensed in the state that your clients are in. So I'm licensed in Nevada. All of my clients are in Nevada.
Okay.
Yes.
It's a pretty big place, though. I mean, actually.
It is. Yeah, definitely. Well, and lots of families are thinking, oh, my, teletherapy is not really going to work with my child. They don't like technology or things like that. But actually, not necessarily the case. With early intervention, so therapy for kids 3 and under, lots of what we do is caregiver education, giving strategies to the families. And so we're just talking, with mom and dad anyway, and giving them strategies, and we can kind of watch how the kid is playing. Sometimes the kid wants to hop on, and that's great. But even if they don't, we can, provide a lot of resources just through teletherapy.
Is it challenging sometimes online to keep a child's focus or attention?
I mean, it's not like 100% successful every minute of every session all the time, but you just kind of find out what the kiddo is motivated by and then make it fun. So we might do a little game or something like that, maybe sharing a little video clip as a reinforcer if that's what they like.
And how are parents involved in the online therapy? Do they need to be in the room? Do they engage with the child? How does it work?
It really depends on the child. And so like what we're targeting, the age of the child, how independent they are. I have kiddos that, if we're just working on sounds or language, if they're like school age, they're just going to sit with me. The parent might be, doing some household things in the background, or maybe even in a different room. I've got other kids that maybe they need a little bit more redirection, and the parent does just prefer to be there. And that's absolutely fine. Whatever the parent prefers, really just on an individual basis.
Okay. Now, I've decided that my child needs your services. You do the evaluation, you set some goals. What does a treatment plan look like? What will I see after meeting with you?
Sure. So we'll talk about the goals, about frequency and duration of the therapy sessions. Because there are so many different things that we look at in speech therapy, I'm not really sure how specific I can get, just because it depends on if we're working on sounds or language. It really just depends. If it's language, we might be doing lots of play and, giving strategies that the caregivers can use all the time, because, I might come once or twice a week for 45 minutes, but when we give the caregiver strategies, they can then do therapy all week long,
Right.
informally, and make it fun. But that's when we can really see more progress, when the families are working on these strategies outside of, that therapy time.
Here's a question I have. Are you back to face-to-face therapy? Is that happening? Yeah.
Yes. Okay. So my company, we do in-home therapy as well as teletherapy, and in-home therapy has shot up as well. I think, parents maybe feel a little more comfortable staying at home, having just one person come in instead of going to a center where there are lots of people, lots of kids. I guess, and another benefit of that too is I'm in the home, I'm sharing strategies with them. Going to a center, it's really going to depend on the place, but I know some places right now during the pandemic, they're not letting parents come past the waiting room. Right. So there's not quite as much interaction between the therapist and the caregivers, talking about what they did during the session, what they can do during the week, things like that. And with in-home therapy, the caregivers can be as involved as they want to be. They can be there playing with us, hanging out the whole time. Or if they kind of want to be getting on with some other stuff, it just depends on, how involved they want to be.
I see. Okay. Is there one activity or method that you'd like all parents to do to boost communication skills from an early age?
Sure. So playing with your child, I know it sounds simple, but doing what they're interested in, and just playing the way that they like to play is huge. Narrating during play. So just, talking about the things that you're looking at, maybe you're doing cars, making some funny sounds and environmental sounds. So like, vroom, vroom, whoa, crash, kids will kind of look at you and like, that's funny. And they get more engaged and excited that way. So play, talking about the things that you're playing with, or if it's a mealtime, talking about the food, talking about the things that you're looking at, that really helps with language development.
That's great. So narrating your day, basically.
Absolutely.
Talking about what you're doing, getting the kid to respond to what you're like, oh, I'm making some breakfast. I think I'm going to make some dinosaur eggs. And just to get a reaction, I don't know. And get them talking, dinosaur eggs. Daddy, where do you get dinosaur eggs? This is anything provocative like that to get a kid going is usually pretty good.
Absolutely. Yeah. Doing or saying something unexpected like that can bring out some new language from a kiddo. So that's really a fun thing to do as well.
Now, I'm really interested. We recently had a guest talk about the Family Learning Initiative in the UK, which basically is an initiative to bring families into the learning experience. And it seems like it's sort of connected to this Hannon Center training that focuses on empowering parents. As, like you said before, they're the primary caregiver, education giver, influence in the child. Can you tell us a little bit about that?
Sure. So, parents are with their children all the time, right? So much more than I'm there. So teaching the caregivers strategies and making sure that the caregivers are comfortable using these strategies is huge, right? Because I can do something, for 45 minutes once or twice a week, and we're, probably going to see progress that way. But, being able to work on these things all the time and in lots of different environments, when they're in the car, when they're at the store, there are so many learning opportunities throughout the day. And it's huge. Research really shows that when parents are using the strategies, we see lots of progress.
It seems like you have to sort of teach the parents as well. You're not teach them, but sort of model behaviors for them.
Absolutely. Yeah. Coaching. Parent coaching and training is huge. And it just kind of depends. Some parents, are just, they kind of want you to work with the kid and you do the sounds. And then, maybe I'll give them some homework, and they may or may not do that. But, especially with the younger kids, when we're, working on language and things like that, that can be just targeted throughout the day. It's really exciting to watch how the kids grow and develop.
Super. Now, you spoke about homework. So I'm interested in the kind of activities you give kids to do between sessions. Like, what should they be doing at home while they're waiting for their next appointment?
Sure. So again, it kind of depends on what we're working on. Like if we're working on sounds, I might, I don't like to give homework until we're, pretty accurate with me during therapy. So if it sounds like we want to be like 60 to 70% accurate with me, because I don't want to give the parents something to do with the kids that's going to be difficult, or they're going to be, practicing the sound the wrong way. I want to make sure that we can do it in the therapy session. We feel comfortable and we're successful, and then the parents can target that. But as far as language, really, I know I'm kind of repeating this over and over, but narrating throughout the day, talking to your children about the things that you're doing throughout the day, focusing on what they want to play with. Because if a kiddo is, playing cars, and maybe the parent thinks, oh, I want to do a book, books are so great for kids, and the kid's playing with the cars and they want to bring in the book. If the kid likes books, they might kind of jump and go to that, but they're playing with cars. You can teach a lot with cars. Right. So just, focusing on what your kiddo is doing in the moment and what they're enjoying.
I would imagine it works pretty similar for kids on the spectrum. Depending on what their issues are, you do kind of the same thing based on what they need the most.
Absolutely. Yeah. Lots of, I guess I don't even want to generalize too much. It depends on the age. It depends on, where skills are, what we're working on, things like that. But certainly lots of play. We want to be modeling language. There's so much I could get into about that, but lots of the same strategies.
Okay. I'm really interested in if you use in your therapy sessions apps like Speech Blubs to complement the work you're already doing, because I know how kids respond to technology and devices.
They do. Kids love technology. And I tell parents, try to avoid screens as much as possible. It's inevitable, and especially during COVID, we're stuck at home. We are going to be on screens. I'm not saying 0 hours a day, but just, try to reduce it. I don't really use too many apps. I will maybe use, if I'm working on sounds, like some pictures with all these words that start with a K, so that we can just kind of go through the pictures, but not too much. I maybe, if the child doesn't have too many like reinforcing items, we might do a little YouTube clip, something like that. So I don't use too many apps. I know parents will always ask, but nothing replaces that face-to-face interaction and playing. I do have to say though about Speech Blubs, I love how when you first download it, so it asks you a bunch of questions about your kids. It's a little assessment part, and parents, make sure that you do this because it's huge. You just answer questions about how your child plays, or, where they're at with vocabulary, things like that, because it will let you know if they are at risk,
Right.
and also some really great tips and tricks that you can get from the app. They've got some great nursery rhymes on there.
From SLPs, speech therapists, they helped us develop it. So it should be something that is relevant. And what I like about it is that if there's any question, the first thing it says is contact your local speech therapist if you have any questions, or just talk with them anyways, even if there is no issue, just to maybe things you could look out for in case something happens. I think you're right. I think that is a valuable tool. Now, at the end of each of our Blub Talks podcasts, I ask for a takeaway. And in your case, because you're an expert speech therapist, I'm going to ask you, what are your top 3 tips for parents thinking about calling a speech therapist?
Sure. So, I mean, you are an expert on your own child. You may hear from friends or even pediatricians, unfortunately, oh, wait and see, they're too young to know. It seems like they're fine. If you feel like there is an issue, you could very well be right. And we don't really want to risk it and wait and see. There's no harm in getting in, doing that evaluation. Maybe the speech pathologist will say, no, your kiddo's fine. And then cool, you don't need speech. Or maybe it's like, hey, let's try a few sessions. I can teach you some strategies and go from there. So getting that speech evaluation, if you have any concerns, is going to be the first one. Getting a second opinion from a doctor, a second opinion from another speech pathologist. If someone tells you, oh, I don't think so. I don't think your kiddo needs speech right now. Or even if you hear your child's not ready for speech, that is not true. I think that just means that speech pathologist maybe doesn't specialize in what your child needs. So find someone else that can help you.
Great.
Let's see. I guess if your kiddo is getting speech therapy at school, getting an IEP is more difficult than, we don't, qualifying for private therapy. If a kiddo has already qualified for an IEP, they can absolutely benefit from outside speech therapy. And it's not for everyone, I know that not everyone has the resources, time to do that. But it's not going to hurt. It could just speed some things along. It just depends on, maybe, I don't know, school therapy is great. I love it that people will have access to that, but it can be difficult to qualify for that IEP because they're kind of strict in how they do that. So just because your kiddo doesn't qualify for an IEP at school doesn't mean that they couldn't benefit from help outside.
Right. Or if I may offer a 4th tip, and not to be too salesy, you could try Speech Blubs and use the evaluation tool at the beginning to give you a sort of a little bit more information about whether your feelings are warranted.
Absolutely. Well, and what I love about it is you just download the app and that's the first thing. There are like some paid features later on, but you download that's the first thing. There are great nursery rhymes on there too. I love doing songs with kids, but the assessment and the nursery rhymes on the app they're really awesome.
Well, thank you, Kjirsten, for sharing your expertise and advice and making us all smarter and more empowered. If you'd like to contact Kjirsten, check out the details listed below this video. And until the next Blub Talks, I'm Robert McKenzie, wishing you what we here at Speech Blubs work very hard to do: joy and success in helping your child speak. Speech Blubs!
Thanks for tuning in. Make sure to like, share, and subscribe for more content like this. Follow us on Instagram, Facebook, and Pinterest at Speech Blubs. Visit our website, speechblubs.com, for more information on speech development created by experts. Last but not least, download the Speech Blubs app to explore how you can improve your child's speech with us.